as we begin the season of Lent this Wednesday, we will yet again be invited to participate in the 3 Lenten disciplines of fasting, prayer, and almsgiving. And we are so pleased that for the second year in a row, we are going to be partnering with our friends at Cherry Health in our Lenten almsgiving this season. And we are so excited and so thrilled that friend of the congregation, Kathy Lipnicki, is here to share with us a little bit more about Cherry Health and how we are going to be partnering with them this Lent. And if you would like to look on page 9 of your bulletin, there is a complete outline of some of the ways in which you can participate in our Lenten alms this season. But would you please welcome back to Park Church our good friend, Kathy.
Thank you so much. Thank you. I just have to tell you, I love being here, but today is more spectacular than any other day I have ever seen. This is wonderful. But good morning. My name is Kathy Lipnicki. I'm the annual giving manager for Cherry Health Foundation, and we're the philanthropic arm of Cherry Health, and we raise funds to provide essential support and fill financial gaps in patient care. I appreciate the opportunity to return to Park Church and update you on the work that Cherry Health is doing. And I'm equally as grateful to be able to thank you in person for your ongoing generous support over the past 4 years. Cherry Health serves as a safety net to ensure that every member of our community has barrier-free access to health and wellness care equitably and comprehensively. Your generosity has assisted us in serving the needs and easing the financial burden for more than 57,000 patients last year. You may recall that last year your congregation chose to support our dental program. Your financial gifts help fill the gaps for the cost of patient care, as well as to retool and reopen our Belknap Commons Dental Center as a walk-in urgent care center. Additionally, your Lenten Community Service Project collected personal dental care items for our clubhouse members, all of whom are adults living with severe and persistent mental illness. They continue to share their appreciation for having received new toothbrushes, toothpaste, and floss. This year, when Terry Hunter contacted me to discuss your congregation's interests and the needs of Cherry Health patients, we agreed that the theme of accessibility and healing, both internally and externally, should be the focus. Everything Cherry Health does is to advance longer, healthier lives and reduce health disparities. To remove barriers, we offer a free sliding fee discount program to ensure that care is affordable for all. We use an on-demand language interpretation service, and we're currently utilizing 72 different languages and dialects to bridge the gap between patients and clinicians. So at Cherry Health, there is no such thing as a language barrier. We bring our mobile vision clinic to schools so that students receive comprehensive eye exams and prescription glasses, because transportation is often a barrier to accessing services. And in the summer, when the schools are not in session, we travel to rural communities and harder to reach populations, as we provide telehealth appointments for patients who are now currently fearful to seek on-site care. Some of our neighbors are feeling stressed, scared, and hopeless. Watching our local news confirms that many are facing untreated behavioral health crises and need healing more now than ever. Therefore, I'm very pleased to share with you that Cherry Health has recently opened our Behavioral Health Access and Urgent Care Center. This walk-in space is the first point of contact for individuals with urgent mental health needs. Upon entry, the patient meets with a behavioral health clinician and a community health worker. The clinician performs an evaluation to determine a preliminary diagnosis, offer brief interventions and education, and provide a plan of action. Based on that assessment, the clinician can schedule referrals deemed necessary for other services within Cherry Health Network, including primary care, vision, dental, women's health, or substance use treatment. And in caring for the whole person, the process is seamless. The community health worker is highly trained, a trusted member of the patient's care team, and they assess the additional needs and connect the patient to community resources in areas such as housing, food assistance, finances, childcare, transportation, and health insurance, just to name a few. For many, entering our Behavioral Health Access and Urgent Care Center is the first step towards healing. We're very appreciative that this year, your congregation has generously selected a Lenten community service project focused on healing the exterior on some of our most vulnerable patients. The collection of personal care products, such as Neosporin, moisturizers, and Band-Aids for patients in our substance use treatment program will truly make a difference. Many of these patients are without resources. Some are unhoused, and skin discomfort and injuries are common complications. We thank you for your financial gifts that assist us in healing our patients on the inside and the community service project you selected to help our patients heal their exterior. Before I close, I wanted to share the exciting news that this spring, Cherry Health will be breaking ground on 56 affordable and permanent supportive housing units adjacent to our Wyoming Community Health Center. It's an enormous step because the connection between health and housing is indisputable. Thank you again for your continued generosity and for the opportunity for me to join you this morning. You're a wonderful, thoughtful, and generous congregation, and we're very appreciative of your partnership. Thank you so much. It's always a pleasure to be here.